Now, more than 3 years into Sudan's war, doctors say that the country's health system is struggling to cope, with hospitals damaged, doctors and specialists displaced, and many patients unable to afford treatment. Dr Abubakr Alallam is a Sudanese doctor based in England and who recently travelled back to Sudan to visit his sick father. He says that the trip also gave him an opportunity to see firsthand how the conflict has affected healthcare services and to speak to fellow doctors about the challenges they are facing. He began by telling me what he found when he returned to Sudan.
My father has been unwell for a few days, so I came to see him, and this gave me a chance to see how the health facilities after the conflict in Sudan. And I managed to speak to many colleagues here about how they feel. They feel there is a huge challenges facing the health system, especially after the conflict. Many of them told me that around 2/3 of the health facilities are non-functioning now. And the rest, which is around 1/3 or 20%, which is functioning, facing many challenges. These challenges, I could divide it into many elements. The human power. Many of the doctors has left the country, displaced. Many of them are high profile, like cardiologists, specialists, oncologists. So you can't find a specialist easy. The medical devices has been distracted directly by the militia, the RSF, and the infrastructure has, especially the power supplies, the road has been distracted. So many challenges are facing the staff working currently in Sudan after the conflict and the war.
So you have been hearing the experiences of fellow doctors, fellow medics. Tell us one experience that has stayed with you.
One of the experiences, people with or patient with breast cancer, they choose to present very, very late, unfortunately. I spoke to an oncology surgeon here who told me that people choose to late present because a lady might choose between buy food for her kids or seek a medical help. So she preferred to buy food instead. So instead of dying from famine, she would rather wait. This is really, really challenging because at the end of the day, she will present to the medical facility, but she will present very late. So instead of having a treatable, removable cancer, she will end up with metastatic cancer, which is unfortunately untreatable, and she might die of it, which is really unfortunate situation.
And relative calm has returned to places like Khartoum now. But, at the height of the conflict, what have people been telling you about how conflict affected them? You talk about oncologists, specialists who are displaced by the war. Just describe to us what you've been hearing and seeing.
When you hear people talking about the situation, they really feel so upset. They feel like they can't do anything for it. For example, if someone ringing for ambulance, there is no, in a state like Jazeera, for example, there is no single functioning ambulance. So if you call for ambulance, someone will just help you from the street to take your unwell relative to the hospital. And sometimes you might need to pay thousands of Sudanese pounds to reach the hospital. And even if you reach, you might not find functioning facilities or even finding treatment for your illness.
Even before the war broke out, about the state of healthcare facilities in Sudan, they were already in very bad state even before the war broke out. How much more so now?
Because I'm currently in Jazeera State, can you imagine there is only single fully qualified GB in Jazeera State?
One general practitioner in the entire state? One?
Only one. In the whole state. There is no single ambulance working in the whole state. Most of the state has no basic facilities. For example, for a neonate, I know this personally, 2 neonates has died because they have been born in a small hospital where there is no CPAP. CPAP is a small device which helping neonate to breathe.
That's a newborn baby, a neonate.
Two has died because they reached after 2 days from being born to search for oxygen or search for VBAC, and it's only one in the whole state. This is really catastrophic.
And given all these challenges, what are people's hopes there in Sudan? You are Sudanese yourself. You've been listening to their stories. What keeps them going?
People are hoping things might get better, but they feel the government could have done a bit better than what's doing now. I think the health is not the top priority for the government. Why? When you walk on the road, you could see a brand new truck for a brand new car for the police, but you will never see a brand new ambulance, which is making things really tricky. There is like a financial budget to buy something. Why, instead of buying a brand new car for the police, why not to buy an ambulance for unwell patient? So I think to prioritize the things might be one of the things for the government to consider, I think.
Dr Abubakr Alallam there, a Sudanese doctor based in England, but who's returned home to visit his ailing father.